Hi, my name is Carla. I'm a student at the University of Dayton studying dietetics. Today I will be performing a nutrition-focused physical exam. I will first gather my tools, which include a pen light, gloves, gauze, and tongue depressors. Before meeting my client, I will be reviewing her medical record to become aware if there are any food restrictions or diseases that are nutrition related. As I follow Diane into the exam room, I am going to look at her neurological abilities. I will see if she is alert, if she is cognitive, and also if she has good balance. I'll see you in just a bit. Before I start the exam, it is important to greet the patient, identify myself, and explain the purpose of the exam, and then get my patient's consent. Hi Diane, my name is Carla. Thank you for meeting with me.
Yes.
Today we are going to perform a nutrition-focused physical exam. What that means is I'm going to look for signs and symptoms of any nutrient deficiencies. I'm going to see if you have abnormal fat and muscle loss, and also check for hydration. Do you have any questions?
No?
This exam will require some touching as I palpate your temporalis muscle in your hands. Are you okay with that?
Yes, I am.
The first thing we will be doing is performing a screening of your hair and scalp. I will first put on my gloves to protect you and myself from any potential pathogens. And I will run a tongue depressor through your hair to check for texture, distribution, and shininess. Now I'm going to screen the oral facial region, beginning with the face. I'm looking for a nice color, even color. I am also seeing if her temporalis muscle is taut and feels like leather and smooth, almost even with the rest of her face. Now I'm going to check the ocular pads to make sure that they are round and maybe slightly bulging out. Okay. Now I'm going to check the oral region. I'm going to check your lips. No cracks, no breaks. And let's look inside your mouth. Can you go ah?
Ah.
Looking for any ulcers or lesions. Normal is no ulcers or lesions. Can you please stick your tongue out? The tongue should be smooth, pink. Now can you lift your tongue up? And there should be a purple vein protruding out. Can you please pull down your lower lip? I'm checking your gingiva to make sure it's not bleeding and it's pink and moist. Can you pull it down just a little further for me? Very good. Diana, do you wear contacts?
No.
Could you please pull down your lower eyelid? I want to check your conjunctiva. It should be pink and moist. And also I'm going to look at your eye. Thank you. I want to check your eye to see if there's any spots, vivid spots. Should be white and clear. Now I'm going to do a hand and nail screening. Hi Diana. I'm going to look for hydration, so I'm going to just pinch you slightly on the dorsal part of your hand and see if the skin bounces back quickly or if it stays pinched. I'm going to check your intraosseous muscle For muscle wasting, can you make like an okay sign? Yeah, I'm feeling it should be taut and bulge out a bit. Next, can you please let me look at your nails? They should be concave, smooth, pink, and strong. The next screening will be to assess for muscle loss. So I am looking at Diane's clavicle. On some women it is slightly visible. On some men it should not be visible. Next I'm going to look at her acromion process and her deltoid muscle. It should be round where the neck and shoulder meet. Diane, can you please bend your arm 90 degrees? I am going to check your tricep brachialis, and I'm going to slightly pinch below. You should have about an inch of muscle. Now I'm going to check your ribs and your mid-axillary level. I would need you to lean against the wall. Okay. The ribs should not be visible. As of here, I do not see them protruding out. Thank you, Diana. Thank you. So that concludes our nutrition-focused physical exam. I hope this was beneficial. Thank you.
In summary, let's look at how we assess fat loss. We look at the orbital fat pads, the triceps, the mid-axillary region, and ribs. The orbital fat pads should be bouncy and lightly bulged. It is abnormal for them to be hollow, depressed, or have loose skin with dark circles. The triceps should have approximately 1 inch of fat tissue when they are pinched. An abnormal finding would be when there is little space between the folds, or when your fingers are touching when you pinch the tricep muscle. The maxillary region and ribs should have ample fat tissue. The ribs should not be visible. It is abnormal for there to be depression between the ribs, loose skin, and the ribs should not be prominent. To assess muscle wasting, we look at the temples, shoulders, clavicle, and hands. The temporalis muscle should be well defined, taut, and feel like leather. It should not be depressed and hollow. The clavicle bone is slightly visible in women and usually not visible in men. It is abnormal for it to be prominent, protrude, or have your fingers slide under the bone. The shoulders should be rounded. The deltoid muscle should be taut and well developed. It is abnormal for there to be protrusion of the acromion process. The hand, when making the OK symbol, will display the interosseous muscle. If that muscle is bulged, it is normal. It is abnormal if that muscle is depressed or flat. To check for hydration, pinch the dorsal part of the hand. The skin fold bounces back after a pinch when released if it is normal.